and please go ahead with your message and update for the community as well.
Thank you. Good morning. And I'd like to just tag on to what Dr. Anderson shared. Over the past week, we've actually seen a slight increase in the number of COVID-19 patients in our facilities. The average has gone up to 48 from about 44 the week before per day. And we're seeing more patients coming through our door, more than about 5 to 6 new admissions a day. Now, it's not just that they're coming in quite sick, because out of the 48 patients, clearly on some times we have more than half of them in that intensive care unit. So sometimes up to 20. Right now we have just over about 17 or 18 in the intensive care unit right now. And when you look at the capacity of our intensive care units, I mean, that is more than it's occupying about 60% of all our beds in the intensive care units. And as Dr. Anderson shared as well, these patients stay longer. So you can see where the challenge is with finding a place to take care of these patients. Aside from that, we are also seeing that we are seeing young unvaccinated patients coming into the hospital. We are seeing some vaccinated patients that have been that have some immunocompromising underlying condition. We also seen that over the past 8-9 months since the vaccine rollout, we've seen about 4% of all the patients we've admitted to the hospital, which is almost 1,000 patients. We've seen about 4% of them have been vaccinated overall. So another area of concern that we're seeing is that we're seeing mothers after delivery. We've seen a few of them are actually deteriorating because of COVID-19. So we are working on that. And one of our strategies has been to also promote the use of the monoclonal antibodies, so that patients at high risk will reach out to them sooner, and we're able to administer that monoclonal antibodies to those who have COVID-19 before they get severely ill. So we're doing everything we can to prevent severe illness. And of course, again, vaccine is the number one way to prevent severe illness from COVID-19. And masking indoors, I will echo what Dr. Anderson shared. In indoor spaces, crowded spaces, masking is highly recommended. Now, besides COVID-19 patients, we've seen a lot of other non-COVID-19 illness as well, and patients are presenting very ill. It just happens to be that time of the year, and I will really not say it's that time of the year. It's what we're seeing. It's higher. We're seeing more patients than we usually see at this time of the year. And when you add that to the burden of COVID-19 infection, you can see why a lot of healthcare systems are very strained right now. And we work very collaboratively to get patients the right level of care. We work very closely with Genesis. We work with outlying facilities as well. And yes, we've even gone farther than 3 hours from here sometimes to get patients placed. So that is the summary we've seen at this time, a summary of what we're seeing with COVID-19 at this time. And vaccine, again, is one of the ways we can prevent severe illness and really get over this surge of illness as well. Thank you
so much for that.